We'll go to our next speaker who actually needs no introduction. Dr. Bharat Dalvi from Mumbai, esteemed interventional cardiologist, and I'm happy to introduce, and it's my pleasure and honor to introduce him. He'll be talking about Cobra deformities, a blessing in disguise.
Respected chairpersons and my dear friends, I have been asked to speak on Cobra deformities, a blessing in disguise. So what this Cobra deformity is all about, it's nothing but a shape memory abnormality, and the shape memory abnormality predominantly involving the left atrial disc of the ASD device, which can resemble a Cobra head, and that's why it's called Cobra deformity, but sometimes may resemble a matchbox, an American football, a saucer, or a tulip. The exact mechanism of Cobra deformity remains elusive. Now, what is known about this deformity is very elegantly described by this paper from Madras Medical Mission, which got published in Cardiology in Young just this year, wherein they have tried to look at over 900 cases in 6 years and found an incidence of close to 11%, pretty high incidence of Cobra deformity of the left atrial disc. And their conclusion was that although no single factor in a multivariate analysis could reach statistical significance, the probable incremental factors included oversized sheath, kinking in the sheath, larger devices, sometimes even the make of the device, and use of spatial deployment techniques, including rotation of the waist of the device. Over and above this, they found that they could correct almost 80% of these deformities in vivo without removing the device from the body of the patient. However, 20% of them required in vitro rectification. And only 4 of the devices needed to be changed because of this deformity from over 900 cases and 11%. So you can say over 100 cases, they needed only 4 patients in whom the device needed to be changed, and there were no major complications because of this deformity. Now, for the purpose of this talk, I have divided this Cobra deformity not into 2, but into 3 types. The spontaneous Cobra formation, the intentional Cobra formation, and the accidental Cobra formation. As a matter of fact, intentional Cobra formation is the basis of a group of techniques which we called as left atrial disc engagement, disengagement technique. And we presented our experience in 2013 in catheterization cardiovascular interventions. The commonest subset in which either spontaneous or intentional Cobra deformity that needs to be used or made use of is large ASDs in small children, where the small left atrium prevents use of routine technique for deployment of the devices. And I'm going to share some of this experience with you. So this is the spontaneous Cobra deformity, and it can take various shapes, as I said in the early part of my talk. So it can take a shape of a saucer, or shape of a tulip, or shape of some American football, or whatever. So here you can see that it's in some different shape. And so these are all different types of shapes which a deformed left atrial disc can take. What is not described in literature is the deformity or the shape memory abnormality of the right atrial disc. So just as the left atrial disc can get involved, even the right atrial disc can have problems of shape memory. And this is one such case where it is so frustrating that despite the fact that the left atrial disc is beautifully aligned with the interatrial septum, and this is a pretty large defect in a small child, but the right atrial disc refuses to form itself, as a result of which this patient, we had to withdraw this device and re-implant it, and the redeployment, of course, was successful. Now, these are some of the examples of intentional Cobra deformities. This is in the left superior pulmonary vein, and you can see how beautifully we have made use of this engagement of the left atrial disc to deliver this large device in a small child. So there's nothing sacrosanct about the left superior pulmonary vein, and you can make use of the Cobra deformity, which can be formed intentionally in the right superior pulmonary vein. And sometimes the Cobra deformity may be extreme, as you can see in this case, a perfect Cobra head. Again, we have made use of that deformity to deliver the device. So don't get disheartened with the Cobra deformity formation, and you can actually make use of that deformity. So rather than pulling back on the cable to disengage the disc, which is in the form of a Cobra head, what we have done is actually pushed on the cable, and that can be useful. And look at the way we are pushing. It's not a linear push, but it's a curvilinear push. So you have pulled back the sheath, you have made the cable redundant and then pushed on it so that the cable doesn't go in this direction, but looks down so as to disengage the left atrial disc. Sometimes in order to get rid of this Cobra deformity, which is intentional, you may have to give a push, which is more than we normally give. So this is an example. But again, here you see the redundancy on the cable. The cable is quite redundant and starts looking down and helps you in disengaging the left atrial disc. So this is the principle. You can see that you can see here that the cable is redundant, as a result of which there is a vector which is in this particular direction, and one component of the vector helps you in disengaging the Cobra formed or Cobra formation of the left atrial disc. Sometimes there can be an accidental disengagement. You can see this in the right superior pulmonary vein. We form this kind of a left atrial disc engagement, and then try to disengage by letting the cable form itself, letting the cable be redundant, but it didn't work out. And then while trying to recapture the cable, there was an accidental disengagement of the left atrial disc, and we were successful in deploying this device. Sometimes the accidental displacement can be made use of. Now, here in this case, we were trying to engage in the left superior pulmonary vein. It accidentally slipped off, got engaged into the left atrial appendage, and we have made use of that engagement in the left atrial appendage to deliver our device. This is an accidental disengagement somewhere in the left atrial roof when we were trying to engage it into the right superior pulmonary vein, got prematurely disengaged, accidental engagement into the left atrial roof, and we are able to deliver the device successfully. So in conclusion, all shape memory abnormalities are not bad. The intentional ones can be extremely useful, on the contrary, as we have shown in our group of techniques called as the left atrial engagement disengagement techniques. Some of the accidental ones may be put to use, as I showed you in a couple of cases, and the remaining spontaneous ones may need correction in vivo or in vitro. So I would leave you with this image of a Cobra charmer, these snake charmers. So you have to take inspiration from them and make the Cobra do what you want it to do. I think with that, I'll conclude my talk. Thanks for your patient hearing, ladies and gentlemen.
Thank you, sir. It was a wonderful presentation as always. And probably the device looks at you more sincerely than any of us. Just a brief question. Do you think the new Trevisio sheath, now the intention in this pyramid is going to keep a RA disc parallel, and then the LA disc forms on its own, and you are having a stern pressure on the RA side? With your experience, a new Trevisio sheath would be helpful for this maneuver or may not be helpful?
I think new Trevisio sheath, in my opinion, for this maneuver will be a disaster. Okay. Because I think it has a very poor pushability. And at least I have not used it. So I can't really tell you just my theoretical understanding of Trevisio. Unless you have a stiff wire to push this and bend on itself to produce that vector to disengage, I think you will not be able to do it. But I think those who are using it may be able to give an answer to this particular question.
With your experience, probably that is the final answer. But yes, Trevisio has taken care of many other things, and we may not need a Cobra to help us out. So thank you for the wonderful presentation. And now we invite our the other panelist, if any question from my other panelist. Okay, we go to the next presentation. It is challenges in closure of post.
Can I just, since there are 14 seconds, can I just show you one thing which I saw day before yesterday?
Yeah, sure, sir.
I'll just take 2 seconds because this was only after I made this presentation. This is the best Cobra I have ever seen. So I thought that I must share it with you. So this is a spontaneous Cobra. I was trying to come from the right superior pulmonary vein. So not once, not twice, but the third time, and you can just see how it just forms itself. So this is probably the best Cobra deformity that I have been able to make use of in deploying the device. And this is a 13 kg child with a 24 millimeter device. Just wanted to show you an example. Thanks for allowing me to share this.
Okay. Thank you, sir, for the wonderful demonstration.